Talking to loved ones about what you want in the event of a serious injury or an illness can be a tough conversation, but it's something that healthcare professionals say is a must. And David Martinez from People's Health joins us to explain why having a plan can make all the difference. Good morning.
Thank you for being here.
So I guess it's called advanced planning.
Yes, it is. Yes,
and
it is.
The idea is that you have a conversation with, usually an older person with their younger kids or adult children.
That's correct. It's trying to take control of your health care decisions when you're still able to do so before you're kind of incapacitated.
You do usually think of this as older family members, but as you point out, it can be something like an injury. It can happen to anybody.
It can. It's a misnomer that it's only for senior adults that you should have advanced care planning. However, an incident can take place at any place in your life, and it's good to know.
Okay, but this is a tough conversation to initiate. Sometimes it's a tough conversation for the kids. Sometimes it's a tough conversation for the parent.
Yes, it is. And we kind of recommend that when you're thinking about doing your advanced care planning, have your discussion with your physician first, and kind of talk about what you would like to have, the kind of health care you'd like to have at the end of your life, kind of prepping you. Have those conversations with your kids.
Yeah, do I want to be on a feeding tube? How long would I want to be on a feeding tube?
Right.
That sort of thing.
Exactly.
Do you think it's tougher on the kids to have it, or the parents?
My experience has been it's been tougher on the kids. I think you may find some of the seniors that may not want to have the conversation, but I've found even with my own children that nobody wants to talk about mom or dad passing away and having that kind of situation.
Because what everybody in the generations needs to understand is it can be an enormous burden if suddenly 2 or 3 siblings are together, or 4 or 5, whatever it is, and you have a disagreement, for one thing, an honest disagreement, or people just don't know, and suddenly you're making life and death decisions.
I've been in waiting rooms with family members, with other families, just talking to them, visiting with them, and one side of the family says, we want to do everything, the other says, I don't.
Okay, so finally, what do you do here? There's a legal foundation here. What are the steps you take to make sure that you're not burdening people and that you get what you want?
Well, there's an advance directive that you can complete. It's a legal document. It's recommended. It doesn't need to be notarized. It just needs to be witnessed. And on this document, Louisiana has one. You fill out. You can just notate what kind of things you want or not want done. Have that with you, have it where everybody knows it is, and that document can serve as your plan for your care.
I'm not suggesting everybody sit around on Easter and talk about it, but when the opportunity presents itself. David Martinez from People's Health.
Thank you very much.
Thanks for your time this morning.